Hello. So we are back. So our lecture topic is fetal period, and I hope you are eager to learn more. So we'll be going through the introduction of the fetal period. In this session, I will be going through the introduction of the fetal period and what is actually the definition of a fetal period. As I told you, we'll be going through the different fetal lengths and how do we measure them and what are the importance of different fetal lengths and how do we use these fetal lengths to assess the growth of the fetus. And especially the most important one is the crown lump length, which is actually the most important measurement indicator of the fetal growth and how we do measure that on ultrasound and actually what it signifies. So, coming to the introduction of the fetal period, the period from the beginning of the ninth week to the birth. As I told you, that before that, first 2 months is actually the stage of embryogenesis. Once the third month is about to start, that is from the ninth week onwards, the fetal period actually begins. And from ninth week to birth or to parturition is actually the fetal period time, and it is characterized by maturation of the tissues and organs and rapid growth of the body. Although rapid growth occurs at the very end of the last 2 to 3 months of the fetal period, but initially first there is only divisions and different differentiations of of what has already occurred in the embryonic period. There is actually growth of those organs and maturation of those tissue organs which has already been formed in the embryonic period. Coming to the fetal length, the length of the fetus is usually indicated as crown lump length, or when the sitting height is, why it is called as sitting height is, although fetus is lying inside the mother's womb, but if we take a line from the vertex, which is from this area of the occipital lobe till the coccyx area in adult, this would become the crown lump length. When they are viewing on ultrasound from the lateral side or from opposite side, they ping one point at a vertex and other at the sacrococcygeal area, and the main straight line joining these 2 points become the crown lump length, which is actually the called as sitting height, because when you are in an adult, when we are sitting, we are actually sitting on our sacrum and coccyx. And then the other is the crown heel length. Normally when we are standing on our heels and calcaneums. So when you are measuring that length from the vertex to the heel of the child, then that is basically the crown heel length. Although crown heel length does not really signify as much, but it's also an important indicator. The reason is that the child is actually, the lower half of the body is not very well developed initially. The major area of the body is actually the head and upper torso, while the arms and limbs are not really developed much. So crown heel length is not much of the major indicator is crown lump length, and they're always expressed in how many centimeters of length they achieve. Now, this is a diagram which is showing an ultrasound view of this. This is, as you can appreciate right over here, that this was somewhere done by 2012 by some doctors. And as you can appreciate is that this is the skull of the baby. And as I told you, this one point is pinged up at the vertex, and then the other is at the sacral area. Now these are the lower limbs. Probably here somewhere are the upper limb buds, and you measure this length. This is termed as the crown lump length. Now there is a lot of controversies as well, because this is highly intra-observable dependent. For example, if I think that this is where the vortex is, I will put one ping here. But if there may be another radiologist who would think that the vortex is not over here, it's over here, and then this length would be slightly different than the this length which I would be measuring. And now when you are measuring these length, maybe a point here or there can make a difference of a centimeter or more. And what actually signifies is, for example, if the length comes out to be too low, or if it is not well measured, the gynecologist may be of the opinion that there may be intrauterine growth retardation. So to make the exact diagnosis whether there is any growth retardation or not, or the fetus, to make certain that the fetus is growing normally or not, we have to be much accurate with this crown lump length. Coming, this is a table which is actually showing there are three things. There is the age, crown lump length, and the weight of the baby or weight of the fetus. CRL stands for crown implant and WF stands for weight of the fetus at different ages. For 9 to 12, you can appreciate these are almost 5 to 8 centimeter. And weight, if you just see on the right side of this, it's only 10 to 45. But as the age progresses, look at over here. By 25 to 28 weeks, at 28 weeks means almost 7 months. At almost 7 months, it's very small increase, only 1.3 1300 gram or 1.3 kg. Fetus may be only 1.5 kg by 7 months, but it exponentially increases to 3.4 kg, almost three times this value, which was at 28 weeks. In last 2 to 3 months, there is an expulsion growth. This results in a large amount of increase in the weight. On comparatively, initially there is look at the length. There is only increase in the length, but as compared to the weight, the length is increasing steadily, but weight explosively increases in the last 2 months. So we have covered up till in this section is that I have covered introduction, or the fetal length, and what are the crown heel length, what is the crown lump length, and why they are measured in centimeters, and what is their role in asserting the fetal growth. And we have been able to see the chart that how actually the crown lump length increases with increasing in age, and how this correlates with the weight of the fetus. So for sex section, keep watching sqadia.com.